Can be complicated and scary for patients and patient organizations that haven't encountered it before. I think what patients and patient groups should be thinking about is, what do the value assessors need to know about this condition, about how it impacts me, how it impacts my family, and how can I make sure that those factors are getting brought through and considered within the value assessment. So the value assessors are focused a lot of times on the cost effectiveness aspect, and they're looking at price, and they're looking at data that was studied in a clinical trial, but oftentimes that doesn't emphasize what people living with a condition are really thinking about when they're making those choices about which medication is right for me, what are the trade-offs in treatments, what risks am I willing to consider for what benefits. And so as patient organizations, we really need to think about how do we bring that information through so it can get considered as part of the value assessment. At the National MS Society, we've been involved in two different assessments for MS, both through ICER, the Institute for Clinical and Economic Review. And one was a large-scale drug review for the entire MS class, and the second, about 2 years later, was for a single specific product. So each experience was a little bit different, but we engaged others within the MS community so that we came together with a number of different MS organizations working through the MS Coalition, and we really talked with ICER early in the process about trying to bring through that patient input and considerations. And so we worked with ICER to develop surveys that really, for the first one, the large-scale MS review, I think was the first time that ICER considered a large-scale patient survey as input that was brought through into the report, and that their reviewers and their committee looked at because it was included in the report. And so really looking at how does the group work together, how does the whole community work together to bring that information forward. And so the MS community came together to really make sure that the patient input was brought through. We worked at various points throughout the time with individual conversations with ICER when we didn't understand something that was happening, and also making sure that we were providing input at every public comment period along the process. To talk to the value assessors early and often, and to not be afraid to ask for information in lay language. Oftentimes the language that value assessors are using is based in economic theory and economic modeling, and it can be difficult to understand, and then it's difficult to understand how to plug into that process and provide meaningful input. So not being afraid to ask for information in a way that you understand it, and keeping an open dialogue with the value assessors along the way. I think it's the biggest barrier for individual patients to weigh in is that it's very difficult to understand the value assessment process, framework, and the language that's used. So patient organizations can do it a little bit easier because we often have more resources and can talk to each other and learn from each other in the process. But for individual patients or caregivers or family members that want to contribute to the process, it's often very difficult.